My name is Joshua Austin, and I'm a dentist here in San Antonio, Texas. And I've done thousands and thousands of crowns in my career. And it's one of my favorite things to do. And it's one of the things that we can do that best helps protect teeth that may have large decay, may have had a big piece broken off, or may be weakened by previous restorations. And it's one of the best things that we can do to help save teeth long term. In our practice, we do mainly all ceramic crowns, meaning there's no metal involved. All ceramic means all porcelain. And so we have a couple of different types of porcelains that we use. One is called zirconia. That's a great restoration for molar teeth. It's very, very strong and it's very durable. It looks really good as well. The second option that we have is called Emax, and that is a great ceramic restoration to be used for front teeth. It's very, very beautiful and does very, very well in the front of the mouth. When determining which type of crown is the best for you, we look at a lot of different things. We take a look at where it is in your mouth. Does it show when you smile, when you talk? We look at things like your bite and where the forces are on the teeth. We look at the other teeth in the area to see if they have any wear and tear from some bite issues or maybe some clenching or some grinding. We take a look at the coloration and see, is the tooth darker, is the tooth lighter? What do we need to match it to, and what material is best suited for matching in that area? So we're looking at a lot of different things. Forces, we're looking at color, we're looking at the overall aesthetic and how much shows when we talk or smile. We're looking at a lot of different factors. We typically will tell you what our recommendation is, and then of course we allow our patients to make the choice that is right for them. When I was in dental school, we did a lot of what we call analog crown techniques, meaning we were taking an actual gooey impression of teeth for crowns and then making usually some sort of metal-based crown. Could have porcelain on top of it, or it could be all metal, but regardless, there was at least a metal substructure in the crown. And of course, all of that has changed. Now we're working 100% digital, so we no longer use any goo to get a record of the tooth for the lab to make our crown. And then, of course, we are using all ceramic materials. Without any goo, it allows us to use our digital 3D intraoral scanner, which takes an intraoral record of your tooth by mapping it digitally. Then that data goes to our laboratory and make us a beautiful, well-fitting crown that hopefully should last you years and years and years and be just as comfortable in your mouth as a newly erupted tooth. The crown preparation and placement process in our practice is pretty easy. It usually consists of two visits. The first visit, we get our patient. We take some beginning records of the tooth, we take a shade, and we get ready for the actual crown preparation part of the procedure. That's where we actually prepare the tooth for the crown. After that part is done, we do some digital scanning with our 3D intraoral scanner. That data goes to our lab, and our lab uses that data to make us your beautiful, well-fitting final ceramic crown. After that process is done, we need to make you a temporary that you wear during the time that the lab is making the final crown. That temporary is tooth colored. It fits very well. It's very comfortable. In fact, it looks very similar to what your final crown will look like, just out of plastic instead of porcelain. During that time, you wear that temporary crown. It should allow you to be able to chew on things. It should allow you to be comfortable during that time. You'll come back to us 7, 10 days later, 12 days later, and we will then take off the temporary and put on the final crown and cement it in place. In our practice, that's generally 2 appointments. The first appointment takes about 90 minutes. The second appointment takes about 10 to 20 minutes. It's very easy and it's something we do every day. And it's a great way to save a tooth that is in distress. Crowns can last a long time in patients' mouth if we take care of them. Maintenance is still vital when you have a crown. Even though the tooth is covered with the ceramic of the crown, there's still a junction of where the crown and the tooth meet. And it's really important to make sure that we have good plaque control, good brushing, good flossing, all those types of things that we would do on a normal tooth to make sure that we take care of it. If a patient takes care of their crown, they can have it for many, many decades. I see patients all the time that have crowns that are 15, 20, 30 years old. I have also seen crowns that are 2 or 3 or 4 years old that need to be redone because they've gotten some recurrent decay around them. They weren't cared for properly. They got some gum disease around them. So maintenance is still required, just like anything else in your mouth. However, if we take care of them, a crown can last for a very long time, and it is a great way to save a tooth that is in distress. We want to make sure that crowns are functional, but they also have to look good too. So we use a very special laboratory named 38 Smiles in Orange County, California, and we work with a very certain technician at that lab, Cindy. And Cindy does a really great job at making us really beautiful crowns. She has a really great eye for anatomy and a great eye for color. During our process of taking records, we'll do a 3D intraoral scan, and routinely I take a special shade photograph of the tooth with a color corrected light so that I can give Cindy the data she needs to make the most beautiful crown possible. With all that amount of information, Cindy can generally make us a great crown that not only fits great and restores function, but it looks great as well and should look great for many years. If you'd like to schedule an appointment to visit about the possibility of getting a crown or some crowns for teeth that need some help, give us a call. We'd be happy to schedule you a consultation where we can do an intraoral scan and some photographs and show you what's going on, as well as some radiographs of the teeth in question. You could also find us on the website, www.joshuaaustinDDS.com. You can even reach us through Instagram by sending us a direct message. We'd be happy to get you set up with an appointment through there if that's the best way for you to set up an appointment. No matter what, just get in contact with us and we will get you all taken care of so that we can get that tooth that's giving you trouble all fixed up and in function and looking beautiful.